Good morning. Thank you for coming and welcome. My name is Mark Skeffington. I'm an Assistant Special Agent in charge with the DEA. We're here to discuss the introduction of the DEA 360 strategy here in this area. We have 4 presenters for you this morning. First to be John Delina. He's the Associate Special Agent in charge for the DEA. Linda Ritchie from the United States Attorney's Office. Carl Alves, the Executive Director of PACA, and Mr. Kevin Hastings from the Elks.
Thank you, Mark. This is a great day. Good morning, and thank you for coming to the DEA 360 South Coast Community Press Conference. My name is John Delina, and I am the Associate Special Agent in charge of the Drug Enforcement Administration for New England. I first want to thank the leaders from the South Coast who are here today in support of this program. I also want to thank the members of the media who are here. It is important that you help us deliver this critical message. Today marks the first day of DEA 360 South Coast. DEA 360 has been deployed to address the fentanyl, heroin, and prescription drug epidemic that the South Coast region of Massachusetts and many other parts of the country face every day. Combating fentanyl and heroin distribution and providing the appropriate education, prevention, and treatment is a top priority for all of us. We all have the same goal, and that is to save lives. DEA 360 is a national initiative that has already been successful in many major U.S. cities, including an ongoing effort in Manchester, New Hampshire, that I am personally involved with. We now turn our focus to the South Coast. The strategy is designed to take advantage of partnerships and is a holistic approach to combating the heroin, fentanyl, and pharmaceutical opioid epidemic, as well as the crime and violence, which all too often goes along with it. This strategy leverages existing partnerships on 3 different fronts: law enforcement, diversion control, and community outreach. First, the primary mission of DEA is law enforcement. We investigate and dismantle the most complex drug trafficking organizations around the world. DEA enforcement activities, which are conducted alongside our outstanding local and state law enforcement partners, are directed at violent drug trafficking organizations and gangs that are contributing to the drug epidemic in the South Coast region. DEA focuses its attention on the distribution networks that are putting this deadly poison on our streets and stealing away our children, friends, and neighbors. Investigative and regulatory activities focus on the diversion of opioid pain pills by medical practitioners, pharmacies, and hospitals to the illicit market. However, the 360-degree strategy recognizes that law enforcement alone is not enough to effectuate sustained community change. The second component of the strategy focuses on partnering with the medical and pharmaceutical community to prevent drug diversion. That is done through education and training. DEA is both a law enforcement and a regulatory agency. We have over 1.8 million registrants, which includes medical practitioners, pharmacies, and hospitals who prescribe and dispense prescription pain medication. We will continue to engage and partner with the medical community. We will meet with industry officials, practitioners, and government health organizations to facilitate an open discussion about prescription pain medication, because in many cases, it is fueling the current fentanyl and heroin epidemic. While the overwhelming majority of medical practitioners and other registrants are doing their job responsibly, there are some practitioners and registrants that are overprescribing. In doing so, they tarnish the reputation of the hardworking and honest doctors. DEA will remain vigilant in identifying and pursuing medical practitioners who are operating outside the law. We are thankful that here on the South Coast, we have so many great partners in the medical field who will be joining us in this endeavor. The third component of the strategy seeks to enable communities to achieve long-term solutions to their drug problems by expanding and leveraging our partnerships with public health officials, community service organizations, educators, parents, and youth groups. Some of these tremendous partners include the Mark Wahlberg Youth Foundation, CATCA, the Elks, the Greater New Bedford Youth Alliance, North Star Learning Centers, Positive Action Against Chemical Addiction, Power Forward, and many others. We know that drug education and prevention efforts are so important because they give our children and teens the knowledge they need to deal with this crisis. But this is not the same prevention that we grew up with. We need to connect with our children younger than ever before. We need to reach them on the platforms that they are most comfortable, like social media. And most importantly, I have listened to our young people, and they are asking to be part of the solution. Once empowered, these children become upstanders and not bystanders to this crisis, which they see and hear about every single day. We have to educate our young people about the dangers of that first illicit use. When we discuss people who are battling this addiction, we spend way too much time talking about their worst days and not enough time talking about their first days. We will work together to empower the children in this region to be educated on this crisis and challenge them to join together with us to stop it. DEA and its partners will also air a number of public service announcements on radio and television and utilize billboards to get this critical message out. In the time that follows a law enforcement operation which targets these violent drug distribution networks, there is an opportunity for a prepared community to take advantage of the time and space created to prevent new drug traffickers from moving in. DEA will work with our local, state, and federal agencies to bring greater enforcement resources to bear. And we will do the same with our community coalitions and partners, providing them with all the resources that we have. Here on the South Coast, there are so many hardworking people who have dedicated so much of themselves to this cause. I applaud them and thank them and vow to assist them in any way possible. One way we will do this is by teaming with the Partnership for Drug-Free Kids to conduct Train the Trainer events in this area so that community groups, educators, faith-based practitioners, coaches, and parents can receive the most current information and ideas for dealing with the opioid crisis. DEA and our partners are committed to finding solutions to this horrific problem. We are in this for the long run. I appreciate the opportunity to address you today, and I am thankful to present what I believe is a tremendous program. My hope is that we continue to uplift and support each other in this fight against drug abuse. I was raised not far from here, about 50 miles north in Revere, Massachusetts. I have seen the devastating effects of this crisis, but I believe in our community and the power we bring to creating healthy, safe, and drug-free neighborhoods. May the lives of those who have tragically passed and those that have been affected by this epidemic inspire us to join together to make this effort a success. Thank you.
Thank you. Good morning. Thank you to Associate Special Agent in Charge John Delina for inviting the United States Attorney's Office to participate today. The United States Attorney is pleased that the South Coast of Massachusetts has been selected as the 18th region for implementation of the DEA 360 strategy. Our office recognizes the importance of the program in bringing together the community groups that play a critical role in prevention and treatment efforts to help those most affected by the opioid crisis. The opioid epidemic is ravaging communities across the country, including New Bedford and the entire South Coast region. The epidemic brings with it drug addiction and a staggering number of overdose deaths. It is a priority of the United States Attorney's Office to work with the Drug Enforcement Administration and other federal agencies to prosecute those individuals responsible for distributing opioids, including fentanyl, heroin, and oxycodone, particularly to the citizens of the Commonwealth. Through the DEA 360 strategy, we will continue our coordinated law enforcement actions against drug cartels and fentanyl and heroin traffickers. The United States Attorney's Office recognizes, however, that federal prosecution of opioid suppliers is simply not enough to address the opioid crisis. Today, we announced the DEA 360 initiative to promote community outreach through local partnerships that empower communities in conjunction with enforcement actions to strengthen neighborhoods through education, through prevention efforts, and through drug treatment. Community outreach is an equally important component of any strategy to address the opioid epidemic, and we, as law enforcement officers, cannot do it alone. The DEA 360 strategy will put a spotlight on the critical work and the commitment of local service providers who are out in our local communities on a daily basis, often working one-on-one to provide outreach to drug users. As the United States Attorney's Office investigates, arrests, and prosecutes the suppliers of fentanyl and heroin for federal prosecution, we often find ourselves at an inflection point. And let me be specific. When we arrest a fentanyl supplier for federal prosecution, we cut off the regular supply of fentanyl to that supplier's drug user customers. It is at this moment that the enhanced DEA 360 strategy will prove most effective. It will facilitate broader and more regular communication between law enforcement officials who primarily are working to choke the supply of fentanyl and heroin, and community leaders who are primarily working to reduce the demand for fentanyl and heroin and to reduce the harm to drug users. The enhanced communication of the DEA strategy will provide better opportunities for community leaders who are best positioned to intervene and provide resources to drug customers to make an impact. To put a fine point on it, the DEA 360 strategy will provide increased and meaningful opportunities for treatment providers to connect with drug users who may suddenly find themselves without a supplier for fentanyl because he or she has been arrested and taken into federal custody. In the end, our common goal is to save lives. The United States Attorney's Office fully supports the DEA 360 strategy and, most importantly, recognizes the critical role that our community partners have in breaking the cycle of opioid addiction. Thank you.
Hi, my name is Carl Alves. I'm with Positive Action Against Chemical Addiction in New Bedford. And I'm very grateful and honored to be part of this program today and the program going forward. And thinking about my remarks, I was thinking about an African proverb that says, to go fast, go alone. To go far, go together. And what DEA 360 is about is bringing people together and moving things forward. I want to welcome DEA. I know that you've been in this community for a while, but now with the DEA 360, I want to tell you about our great community. We're robustly diverse. We have some really wonderful initiatives and programs, agencies, individuals that are doing significant work in this area. And I'm happy to represent them at this podium today. But we need more help. And so I think the involvement of DEA 360, as you get to know us better and better and understand all the different strategies that we have in place currently and how we can leverage each other's resources to really save lives and uplift our community. Very grateful for all that you do. I've worked with justice programs in the past, been doing this work since 1991, and there's a lot of best practices that could be brought to the table from other parts of the country. And we have some good ideas that we could share with other parts of the country as well. I think together we will go far, and we will uplift our region. Thanks.
Good morning. My name is Kevin Hastings. I'm the State Drug Awareness Chairman for the Massachusetts Elks. The Elks and their 43,000 members in Massachusetts are here because we care. Elks share, Elks care. We have pamphlets which are up to date on all the information on drug awareness. We have videos. We are here to assist you in any way that we can, with manpower, with whatever we can do. The Elks care, the Elks share, and we are here to assist you in any way possible. Thank you.
One additional presenter is Chief Kyle Hackney from the Attleboro Police Department.
Thank you. Good morning. I'd like to thank, on behalf of all law enforcement agencies involved in this project and the 360 DEA program, from the grassroots organizations, the public sector, privacy. We love working and engaging in these types of endeavors. We are in a crisis. It's divisive. It's in every single neighborhood, community. It doesn't matter about population, city size, town size, it's everywhere. I bet we could touch every person in this county that's probably experienced a friend, a loved one, a neighbor that's experienced an overdose or a death they're from. In any crisis, they say there's two things that you have: hope and time. However, with programs like this, I say there's a third, and that's love. And God willing, that's what's going to get us through this: hope, time, and love with programs like this. So thank you, DEA, for bringing your resource to bear on this heavily weighted down opioid crisis in our community and our county-wide. Thank you.
That concludes our presentations this morning. We can stay a little bit longer and talk to anyone that has any questions or any concerns. Thank you. Thank you for coming.
Thank you, everyone.